All right, let's jump right in. If you or someone you know is on Medicaid in Virginia, you've probably heard about a pretty big change. Today, we're going to break down exactly what this new system is, what it means for you, and most importantly, how it makes getting the care you need a whole lot simpler.
For the longest time, trying to understand Virginia's Medicaid system felt, well, a little confusing, right? You had all these different names flying around. Medallion 4.0, CCC Plus, FAMIS. It was totally normal to feel a bit lost in all that. If that was you, trust me, you were not alone.
But as of January 1st, 2023, everything got a major upgrade in simplicity. As you can see here, Virginia went from that whole collection of different programs to just one single unified program. The whole idea was just to make things easier for everybody. And that new all-in-one program is called Cardinal Care.
So let's get right into the nuts and bolts. What exactly is Cardinal Care, and how does it actually work for you?
The easiest way to think about Cardinal Care is as a big umbrella. It's the new single name for everything related to Virginia's Medicaid and FAMIS programs. The goal here is to get rid of all that confusion and make sure every Virginian who's eligible gets the right care when they need it, without the headache.
Okay, now this is probably the most important slide, so let's pause here. What's really crucial is what hasn't changed. Your actual benefits, they're the same. Your doctors and your managed care organization, your MCO, all the same. Nothing has been taken away. The only things that are new are the name, you'll get a new ID card with the Cardinal Care logo, and there are some minor administrative updates for some people.
And let's clear up one major point of confusion right now. You might hear the name Cardinal Health and think it's the same thing. It is absolutely not. Cardinal Care is Virginia's official Medicaid program, the one that handles your health care. Cardinal Health? That's a totally separate national company that deals in medical supplies. So when you're thinking about your health care in Virginia, it's Cardinal Care. Period.
All right, so now that we've got the system figured out, let's talk about the really good stuff. How you can use these benefits for something vital, like getting health care right in your own home.
One of the best things about Cardinal Care is that it covers a wide range of home health services. And we're talking about everything from help with daily activities all the way up to skilled medical care from licensed pros. So let's take a closer look at what that actually includes.
So first on the list is personal care. This is all about getting that extra support for daily activities that helps you or a loved one stay independent at home. We're talking about help with things like bathing and dressing, preparing simple meals, remembering to take medications, or even just having someone there for companionship and help getting around.
Next up is skilled nursing care. Now, this is a more medical level of support that's provided by licensed nurses. This is for things like keeping an eye on chronic conditions like diabetes or high blood pressure, taking care of a wound after surgery, managing complex medications, or performing treatments right there in the home. And finally, Cardinal Care also covers therapy services at home, as long as they're prescribed by a doctor. This could mean physical therapy to help you get your strength and mobility back, occupational therapy to work on skills for daily living, or even speech therapy to help with communication or swallowing issues. Okay, so you know these amazing services are covered, but how do you find someone to provide them? Well, let's use a real-world example. If you're in Northern Virginia, you'd want to look for a certified agency like At-Home Personal Care Services. And here's what you should be looking for in any agency. You want one that's CHAP accredited. That just means they meet really high national standards for quality. And of course, they have to be Medicaid certified to work with Cardinal Care. Other great things to look for are bonuses like bilingual staff and a wide service area that really covers the community's needs. All right, let's bring it all together. We've talked about the what and the why, so now let's focus on the how. Getting this care is actually a pretty clear, straightforward process.
It really boils down to 3 simple steps. First, if you were already on Virginia Medicaid, you don't have to do anything. You are automatically moved into Cardinal Care. Easy. Second, you'll need a referral from your doctor or MCO. And third, you just contact a provider like At-Home Personal Care Services, and they can help you with the rest, from checking eligibility to getting care set up.
And to make that final step as simple as possible, here's the number for the provider we've been using as an example. A certified agency can answer all your specific questions and really walk you through the process of getting in-home care services with your Cardinal Care benefits. At the end of the day, the big switch to Cardinal Care was all about making things clearer and more convenient for you. Knowing that this kind of high-quality, personalized care at home is part of your benefits is empowering. It gives you the tools to live a healthier, more independent life. So the real question is, are you ready to put those benefits to work?